So it says, walk through the setup for a shoulder MRI. So first we will demetalize, sanitize, disinfect. We will go over our order, place the linens, answer any questions, ask if they need to use the restroom, contrast, consent, follow, aid it, and then we will go ahead and give them, make sure they have the squeeze ball and hearing protection. And then it says, what goal is used and how is the patient positioned? We will use a dedicated shoulder coil, and then they should be supine head first. And describe the angulation and coverage for the axial, sagittal, and coronal sequence. For the axial, we will angle parallel. Well, we will angle perpendicular to the joint space, will be the glenohumeral joint on a coronal image, and then we will be perpendicular to the humerus on a sagittal. We will cover from superior to the acromoclavicular joint and into the shaft of the humerus into the axilla. Coronal angulation should be parallel with the supraspinatus tendon on an axial and parallel with the humerus on the sagittal. We should cover the entire bony anatomy joint slash joint and most of the surrounding muscle. The sagittal angulation should be perpendicular with the supraspinatus tendon on an axial image and parallel with the glenohumeral joint on a coronal image. It should cover from the skin through the entire joint space and a few slices in the scapula. And then for the wrist, we will walk through the setup for a wrist MRI, which will be demetalize, sanitize, disinfect, go over any questions, ask if they need to use the restroom, contrast, consent, make sure they have the squeeze ball and hearing protection. We would place our linens and go over our order once again. And then what coil is used and how is the patient positioned? We will use the HD wrist coil, head first prone, which means Superman. If they cannot raise their arm over their head, we will lay them supine. And then where is the laser landmark set? It will be the carpals. And then describe the angulation and coverage for the axial, sagittal, and coronal sequence. The axial angulation should be parallel with the carpals joint slash joint space on a coronal, perpendicular to the metacarpals slash joint space on a sagittal, and then it should cover from the metacarpals to the radius and ulna through the entire wrist. And then for the coronal, we will angle parallel to the radius and ulna and the carpals on an axial and sagittal image. And then the coverage should cover from skin to skin, from anterior to posterior. And then the sagittal, we should angle perpendicular to the radius and ulna slash the carpals on an axial, perpendicular to the joint space on a coronal, and then it should cover from skin to skin at the wrist joint.